We are here today to announce the opening of a new shelter for people experiencing homelessness who are also dealing with severe substance abuse, mental illness, or sometimes both. This new shelter will be filled with the help of special outreach teams known as Community Harm Reduction Teams, also known as CHART, who will help identify homeless individuals who will benefit from this shelter's more intensive services, including substance abuse counseling and licensed mental health clinicians. This facility is a result of the collaboration and cooperative relationship between the City of San Diego and the County of San Diego. The county has extensive behavioral health expertise, and so Chair Fletcher worked with the healthcare experts under his purview to design an outreach and case management program to fit this facility. My team worked with the Housing Commission to identify and prepare this building. Some of you may remember it as an old Pier 1 retail store, and the building is owned by the City of San Diego, and to convert it into this shelter use. These 44 beds, I want San Diegans to know, is just the beginning. We're working to identify additional locations for what we will call CHART Safe Havens, which would offer that high level of care for those with those more acute challenges. We have great Housing Commission staff. Lisa Jones was mentioned. I want to acknowledge Molly Chase, Jonathan Herrera. We have some great people at our Housing Commission that are working hard on this.
The program we're launching today is different than something that we've done in the past, and it is a recognition that there is a category of individuals who are unsheltered who have very serious problems. Very acute substance abuse issues, perhaps alcohol dependency, mental health issues, a category of folks for whom a lot of the normal outreach and housing programs simply aren't enough. And so by launching our community harm reduction teams, we're launching a new category, a new program and effort that's designed to meet a need that is not presently being met. And that is what makes this unique and what makes it different. But the outreach worker alone doesn't help at all if they don't have a place to take them. And that's why this facility is the first step in what we're doing, is the place those individuals can come and get a higher level of care, a higher level of services that is uniquely designed to meet their particular needs. And we think that this has tremendous promise to help us with some of those who are struggling the greatest.
The CHART team will use a harm reduction approach or model of practice to really begin to work with the client from a person-centered approach, from a client choice, and offer an array of service needs based on their needs, whether it's physical health or behavioral health, or ultimately, of course, housing. And this opportunity for this shelter is dedicated to this cohort of clients, very specific and intentional and purposeful. So we work very well, very close together with Alpha Project to create a client-centered approach and plan for these individuals, not only for treatment, but also for an exit strategy, right, to permanent housing, which ultimately is our goal.
This facility, and you've already heard, is going to be a place for the most infirm. Just think about it. It's cold out there. And it was rainy out there yesterday, and it's miserable out there. And just think, there's some folks out there right now that have no idea that their lives are going to change in this facility. We're going to build long-term relationships with these folks and make sure that they have the best opportunity to succeed and to regain their independence. We are as committed to this community as we are to our residents. So many times, folks, and justifiably so, they don't want shelters, they don't want places in their communities because of the negative impact. If you go to any Alpha facility, and when we started 35 years ago, our commitment was both ways. First to our residents and first to the people we were trying to help, but also to the communities that we're in. This place is already much better than it was.